Hey guys, this is Dr. Hub. Today we'll look at the classification. This is of the opioids. Classification of the opioids. And this will be based on the action on the opioid receptors. It is on the action on the opioid receptors. So to begin with, first we look at morphine. So in terms of morphine, we have the mu, delta and the kappa. So these are the components we are going to assess. So the positive finding is what we are going to look at. So in terms of mu, it is positive. So mu is positive. And then what about the kappa? In terms of kappa, it is positive. Next, let's look at the methadone. So methadone also, the M and the M, right? So all M's have a positive mu. So here the mu is again positive. Next we are going to look at the meperidine. So how is the meperidine? In terms of meperidine, again there is a positive. It is positive. Then comes the fentanyl. So fentanyl is also positive. This is positive for what? It is, we are just discussing about the mu. So it is positive for the mu. Then we look at the sulfentanyl. So how is the sulfentanyl? Sulfentanyl, if you see, there is a mu. So mu is again positive. Then comes the delta. So delta is positive. And what about the kappa? The kappa is again positive. So in sulfentanyl, we see the receptor effect of everything, that is the mu, delta and the kappa. Next we look at the codeine. So what happens in case of codeine? In case of codeine, there is a positive and negative impact on the mu receptor. This will be the mu receptor. So what we have noticed so far is whatever begins with M, that is a morphine, methadone, meperidine, everything has only the mu. That is, mu is definitely positive. In case of morphine, only in terms of morphine, there was an increase in the kappa. So we stopped with codeine. Next, to continue with, we look at the pentazocine. So we look at the pentazocine. So what happens in the pentazocine? In terms of pentazocine, there is a positive and negative on the mu receptor and also the kappa. So this is a pentazocine. It has effect also on the kappa. This is again, in case of kappa, it will be a positive. It will be positive. Then we move on to the nalbuphine. The nalbuphine. So in terms of the nalbuphine, there is a negative impact. This will be on the mu receptor. And then there will be a positive. There will be positive on the N for negative. So N will be for the mu, and then in case of kappa, it will be positive. Next we are looking at the buprenorphine. In terms of buprenorphine, there is a positive and negative on the mu receptor. Then in case of the delta, there is negative, and in case of kappa also there is negative. Now we look at the butorphanol. So what happens in case of the butorphanol? So in terms of butorphanol, there will be an increase and decrease. This will be in the mu receptor. This will be a mu receptor. And looking at kappa, there will be a positive impact. So this was about the classification of the opioids based on their actions on opioid receptors. To learn and grow daily like this, please do subscribe.